Really bad cramping during your period? Need to absent from school or work again? To be productive or feel normal, do you need to take a lot of pain meds on your red days? If yes, listen up. These symptoms, while common, are not normal. You may have endometriosis. Endometriosis is a lifelong disease that can result in poor quality of life, chronic pelvic pain, and infertility. But it can be controlled. Lifestyle changes and medications are key. Surgery can be avoided in most cases and is done only after very careful consideration by you and your specialist. Improve your reproductive health, your well being, and your quality of life today. Get yourself checked by your doctor now.
The pill. You know, the pill. Just two unremarkable words. But 60 years ago, it changed the world in a remarkable way, supporting women to have children by choice, not chance. It helped us pursue our own ambitions and take on the world. It empowered us to reach for new heights, support the children we have, and strive for lives free from hardship, to shape our own futures, and to shape others, and to live our lives our way. 60 years ago, a world of opportunity started with the pill. Since then, Bayer has been bringing women benefits in contraception and beyond, and continued to innovate, decade after decade. All that started with just one little pill. Celebrating 60 years of empowering women. Bayer, your partner in women's health.
Does your browser history look a little like this? If yes, you may be one of 10 women who suffer from the symptoms of endometriosis. So what is endometriosis? Normally, the tissue lining of the uterus, called the endometrium, grows and sheds in the uterus during regular menstrual cycles. Women suffering from endometriosis, however, have endometrial-like tissue growing where it's not meant to be. Similar to the endometrium, these tissues thicken and try to shed with every menstrual cycle. They irritate surrounding tissues, causing inflammation, scarring, and adhesions that cause chronic and clinical pain to women who suffer from this disorder. If you feel you could be one of them, know your options and visit health professionals that can help you end the search and find your answers.
Really bad cramping during your period? Need to absent from school or work again? To be productive or feel normal, do you need to take a lot of pain meds on your red days? If yes, listen up. These symptoms, while common, are not normal. You may have endometriosis. Endometriosis is a lifelong disease that can result in poor quality of life, chronic pelvic pain, and infertility. But it can be controlled. Lifestyle changes and medications are key. Surgery can be avoided in most cases and is done only after very careful consideration by you and your specialist. Improve your reproductive health, your well-being, and your quality of life today. Get yourself checked by your doctor now.
The pill. You know, the pill. Just two unremarkable words. But 60 years ago, it changed the world in a remarkable way, supporting women to have children by choice, not chance. It helped us pursue our own ambitions and take on the world. It empowered us to reach for new heights, support the children we have, and strive for lives free from hardship, to shape our own futures, and to shape others, and to live our lives our way. 60 years ago, a world of opportunity started with the pill. Since then, Bayer has been bringing women benefits in contraception and beyond, and continued to innovate, decade after decade. All that started with just one little pill. Celebrating 60 years of empowering women. Bayer, your partner in women's health.
Does your browser history look a little like this? If yes, you may be one of 10 women who suffer from the symptoms of endometriosis. So what is endometriosis? Normally, the tissue lining of the uterus, called the endometrium, grows and sheds in the uterus during regular menstrual cycles. Women suffering from endometriosis, however, have endometrial-like tissue growing where it's not meant to be. Similar to the endometrium, these tissues thicken and try to shed with every menstrual cycle. Surrounding tissues causing inflammation, scarring, and adhesions that cause chronic and clinical pain to women who suffer from this disorder. If you feel you could be one of them, know your options and visit health professionals that can help you end the search and find your answers.
Really bad cramping during your period? Need to absent from school or work again? To be productive or feel normal, do you need to take a lot of pain meds on your red days? If yes, listen up. These symptoms, while common, are not normal. You may have endometriosis. Endometriosis is a lifelong disease that can result in poor quality of life, chronic pelvic pain, and infertility. But it can be controlled. Lifestyle changes and medications are key. Surgery.
Lord, as the sun lights another day, in silence we seek your grace and pray. To hold our hand as you guide us on the path to start a life. We gather here today in glory and praise. The privilege to hear we share with one another, to witness your greatness, our commitment to each other. We ask in all humility your grace within our core, to uphold our patience, dignity, we give our all. Therefore, coming together we strive to serve and to lead, finding strength in each other, your love as our shield. The privilege to heal, we share in one privilege to be. We share with one another to witness your greatness, our commitment to each other, our commitment to each other. Our work begins with women and men who need a helping hand, instilling hope in the minds of couples yearning for a life with a child. Professional integrity embedded in our core, along with clinical excellence. These are our goals. Therefore, we continue to invest in treatments that are best. The sanctity of life, the joy of creation, our sacred commitment to the families of our nation, the sanctity of life, the joy of creation, our sacred commitment to the families of our nation. We are tireless together in creating a future, caring for the Filipino before the century beyond. This is our path. This is our path. The sanctity of life, the joy of creation, our sacred commitment to the families of our nation, the sanctity of life, the joy of creation, our sacred commitment to the families of our nation, to the families of our nation.
Good evening, everyone. I am Dr. Amity Casirotrano, and I will be your moderator for this event. So I'm sure that most of us have heard one too many lectures already about endometriosis. But for tonight, we will not be having our usual lecture format. And I promise you that it will be more fun, parang more fun in the Philippines, and interactive because we get to ask more questions from our endometriosis experts. So, pwede natin silang pagurin. Okay, so game na. To open our event, I would like to call on this person who sincerely encourages patients, inspires younger reproductive medicine specialists like myself, and the one who leads PSRM tirelessly, our beloved dear President, Dr. Debbie Guani D. Megizo.
Good evening, everyone. As the Philippine Society for Reproductive Medicine is a society of OBGYN who specializes in all aspects of reproductive medicine, which include endometriosis. Thus, allow me to open Endometriosis Awareness Month with our first lay forum for the year. As we all know, endometriosis is a chronic disease which needs continuous monitoring and subsequent treatment. This becomes a part of our patient's life. The society has been having discussions for the doctors, and now we want to reach out to our patients. We are very proud to have this forum tonight with our partner Endometriosis Philippines, which will be represented by Ms. Leia Epistola, an endometriosis advocate. Tonight is the night you can ask all your questions. We have Dr. Delphine Tan and Dr. Maris Yap Garcia to answer all your questions. Again, welcome everyone and enjoy the evening.
Thank you, Ma'am Debbie. Okay, so let's go to our first speaker already. No, our first speaker is not only a clinician, but is also an advocate speaker for endometriosis. And flashed on your screens right now is the list of just some of her positions, affiliations, and achievements. You know what? I just love listening to her lectures. Her slides are always well prepared, and she's always so composed, no? And I can just imagine her when she talks to her patients. Kung patient nga ako, feeling ko with pelvic pain, mas marirelax talaga ako because she's soft spoken and is always smiling. So let's all welcome one of my ates, Dr. Maris Yap Garcia.
Thank you very much, Amity. That's such a sweet introduction. Yeah, it's true. I'm her ate. We grew up together in St. Luke's, and thank you very much, Amity, for a very warm introduction. So good evening, everybody. Like Amity said, no, we're here today to talk about something really quite important. No, we want to answer all your questions, but probably with endometriosis, to be honest, maybe we won't be able to answer all of them. Maybe what we did conceptualize in this forum is really to turn our patients into advocates, because really, as like with many female diseases, our diseases are not very much talked about. In fact, endometriosis is probably one of the most common diseases and one of the most severe ones in terms of symptoms, but it's also one of the least well known. And that's really a mystery to me now. And today we're going to try to change that. We're going to start the conversations that will help further our care for our patients. And if you're anything like my children, you like stories. And so I'll start with a story first now. So let's start with the story of hysteria. So hysteria really means, we know what it means now. It means running amok, being inconsolable, crying, etc., etc. It's largely a female description, right? And it did start with the female because, hysteria was present. The term was coined long, long ago. In fact, maybe in the early, during the Greek period, no? Hysteros is actually, if you know hysterectomy, right? It means removal of the uterus. Well, hysteria is linked to the uterus too. And during those times, it was enveloped in a lot of mysticism, a lot of myths, but they knew it to be an actual disease. What they thought at that time was there was a wandering womb, and that it was animalistic in nature, and that it actually traveled around the abdomen in search for a child. And so I think that was the pretext for one of the most enduring narratives in medicine that we know now. It's that when you have dysmenorrhea as a child, if you get pregnant and have a child of your own, then the dysmenorrhea will go away. And so this was present a long, long time ago. And so this was it has been attributed to so many things like demonic possession, witchcraft, but largely during that era they knew it to be an actual disease. And for me, this was, I would have been grateful as a patient for my doctors to actually treat me like it was an actual disease. But unfortunately, sometime in the 1400s, maybe because our doctors did not understand it, it turned into something that they thought was all in the mind. And so it became a psychological disease. And you see here this patient in chains, no, in the St. Bethlehem's Hospital in London. And just a bit of trivia, St. Bethlehem's Hospital is actually Bedlam. That's the colloquial term for it. And now we know Bedlam means craziness, right? So that's where it came from. And this is how these women were treated. But then it went back and forth, and suddenly it was at a topic again. And we have here Dr. Charcot, who actually advocated for women. It doesn't look like it here, but he's advocating for her. He's saying that she has hysteria, but it's an anatomic problem, right? One of his students is the renowned psychiatrist we now know as Sigmund Freud. And Sigmund Freud thought otherwise. He thought hysteria was a psychological problem that needed to be psychoanalyzed. We know Sigmund Freud is the father of psychoanalysis, right? And I think this was a major step back in the treatment of hysteria. And honestly, a lot of scholars think hysteria was endometriosis before, right? Hysteria and endometriosis were synonymous in the olden times. But because of this, hysteria suddenly became something else. It became something in the mind, and that's how it was treated. And it suddenly became so nebulous, and all of a sudden, because it was something nebulous and psychological, now it's gone. It no longer exists in the Manual of Diseases. In the 1980s, they scratched it out. And now we know it's just a word. I'm talking about hysteria now through the lens of endometriosis, because there are a lot of parallelisms with endometriosis and hysteria. In fact, like I mentioned earlier, it's actually maybe the same thing. And we do not want endometriosis to be treated the way hysteria was treated. But I don't think endometriosis will go away, because we're paying attention and we know it to be an actual disease. But it's taking so long for us to get treated, right? And there's a disconnect somewhere. And I know the patients like you, I'm sure a lot of you are here feeling pain, etc. You can't wait to find the treatments, to find the doctors who will say your disease is valid, what you feel is valid, and we have something to help you with, right? You can't wait for that, but it's taking so long. And that's why we're here today. So what is endometriosis? Endometriosis occurs when tissue resembling the lining of the uterus, that's the endometrium, grows outside the uterus. The fallopian tubes are open, right? We have the uterus, the fallopian tubes, they're open. And so the most popular theory is that some of the menstrual blood goes out into the abdomen through the fallopian tubes and stays there. But it's a very complex process, and I really won't go into the details of that. But essentially, what happens is every time you menstruate outside, you menstruate inside as well. And scarring, adhesions, inflammation happens every time you do that. So the symptoms are akin to inflammation, right? Widespread inflammation, in fact. And this manifests as painful periods, severe cramping, heavy bleeding even, and pain during intercourse, painful ovulation. And eventually it becomes something else. It affects the bowels, it affects your urination process. And then patients suddenly develop masses like big cysts, chocolate cysts, their uteri become large as well. And so it becomes more complex. It is not uncommon. They say there are about 176 million women worldwide who have it. But I think it's even more. Maybe more than 1 in 10 women have it. It's just that we're quiet about it. We don't, it's normalized. We were told to not talk about menses, not to talk about our girly parts. And so we're quiet. And I think it is highly underdiagnosed. Unfortunately, endometriosis happens during a time when a woman is supposed to be at her best. She's supposed to be at her most functional. This is a woman at the start, a child or an adolescent who is gaining connection. She's making friends. She should be making friends at this time. She should be deciding on her career and making steps towards that. She should be deciding her lifelong partner and having romance in her life. And then she should be building a family during this time. Can you imagine having a chronic disease during this time when you should be at your best and you should, things should be rosy and bright? I can't. That's why I really feel very strongly about this. So, like I mentioned earlier, it's probably the largest women's health crisis of our time. If you look at the data, it takes 8 to 10 years for women to get diagnosed. Can you imagine a man getting dysmenorrhea? If a man gets dysmenorrhea today, he will be at the doctor's office today, and he will be asking for medications today. It's not the same for women. We've been, probably because historically we were burned at the stake or put in chains in bedlam. Maybe that's why we were taught to be quiet, and we need to have a voice, right? 2 to 3 times. It's if you have endometriosis, your kin are 2 to 3 times more likely to have endometriosis. So we see a familial aggregation as well. There is lost productivity for sure, at least 10 hours of work per week. And there is an economic loss as well. In the US alone, about $119 billion a year is lost because of the endometriosis symptoms. And this could even be more because it causes infertility. And infertility, as we know, is a very expensive disease. So there are a lot of, like I said, it's cloaked in a lot of mysticism. There are a lot of myths about it. And one of them is, that hysterectomy or childbirth is a cure. We now know that it's not. Unfortunately, it's not. It can help stave off the symptoms, but endometriosis is a lifelong disease, and there is no cure. Missing school or work due to pain is normal. We know this we see this a lot. A lot of our sisters, our friends, sometimes they miss work, they miss school because they have dysmenorrhea, and it's an acceptable fact, but this is not normal. If you have severe pain that impedes normal function, please see your doctor immediately because it's not normal. They also say that the level of pain relates to the stage of disease. We now know that it's probably not true. We have a lot of patients with mild disease when you look inside, but who have severe pain. That's valid. It's still valid. There are patients who have severe disease inside, but who do not complain very much, and they come to you maybe with another complaint. No, but this is something that is very mysterious to us doctors as well. So this is one of the earlier phases of endometriosis, and it's also a phase that we see a lot. No, we see it in our little sisters, in our young patients. We see them being comforted by the mothers, being given, hot compresses, and being told that it'll go away. Don't worry. When you're older, it'll go away. But sometimes it doesn't. Sometimes it gets worse. Many times it gets worse. And these girls deserve treatment. These are the girls who need long-term hormonal treatment and pain relievers. And by long-term, I don't mean just 6 months. It can mean until the time when they want to have children. And this comes in many forms. There's oral, there's you can even opt to give an IUD with medication. There is also an implant, and these really afford treatments for a long time. No? So the next phase of endometriosis is a patient who doesn't have a lot of symptoms, but who comes to you because she can't have children. And then lo and behold, when you do the scan, she has a cyst, and she has an endometriotic cyst, and it's endometriosis. These patients need treatment as well, and they need medically assisted reproduction because their goal is to have children, we should help them get children. We should not suppress ovulation with hormones. We should help them get pregnant. And medically assisted reproduction is warranted. What does this mean? Maybe artificial insemination if she's very young. But it can also mean, maybe she needs IVF already, especially in older patients or those who've had previous surgery. Think that maybe she needs IVF. Now, this is another face of endometriosis. It's not the face, right? It's the inside. But I just wanted to point out that this is really some severe disease, right? And these patients sometimes, if there's rupture of a cyst, they come to you in the emergency room because of severe pain. They think it's appendicitis, but when you open it up, it's endometriosis. We see a lot of these patients as well. When you probe into their history, they've had a long-standing history of pain monthly, but they never knew that their disease was this bad. And these patients deserve surgery. And when you do surgery on them, it should be the proper surgery. It should be excision surgery. And before that, you need to know whether or not, especially if they don't have children, you need to know their goals in life. Like, for example, if this lady doesn't have children yet, maybe you should investigate whether or not she has a lot of eggs left. And the plan should be to leave the uterus and the ovaries behind and excise the disease itself. It's very different if a woman is older, she's finished having her children, and she's sick and tired of her uterus, sick and tired of the pain. Then you can think about removing the, it's a shared decision between you and her, between the doctor and the patient, whether or not she needs to remove her uterus, and it's valid. This is the face of endometriosis that I'm most afraid of as a clinician. It's the face of a woman with chronic pelvic pain. And many times you see her, she's walking around you, she's functional, she's working, but deep down inside, this is what she feels. This is a word cloud that I came up, it was something, I just wrote in endometriosis word cloud. And this is what the word endometriosis is associated with. And it's sad, it's agony, hell, stabbed. These are words that patients use to describe their disease. And I cannot believe that it takes 8 to 10 years to treat these patients, given that these symptoms are so bad. And, chronic pelvic pain, I say, is a different animal because in my mind, it's end organ damage. It is a complication of neglect. And it is real, and it's not in the head. It's because of chronic inflammation the chronic inflammation that I was talking about earlier, that happens to make sickness behaviors happen. And there is a biological basis for this. Even the brain changes in response to chronic pain and the inflammation. There is a sort of short circuitry that happens. And so these women experience pain in a different way. It's not because they have low threshold for pain or not because they are weak. It's because their bodies are different because of this illness. And so obviously, treatment for endometriosis is very complex, right? I always talk about the tiers of management, and these include, of course, lifestyle, diet. It includes even cognitive behavioral therapy, because a lot of these women who come to you have had years of pain, so they have to unlearn the pain that they feel. Medications are there, right? And they don't always all work, but the good thing is there are so many options. And you can go over those options one by one with your doctor. You can combine them. Surgery, nerve blocks, and other treatments are also there as second line. We usually do them in patients in whom medications don't work. Or, of course, if you think that there is an underlying problem that is not endometriosis, like cancer, or if a patient comes in, like the patient earlier, in acute abdomen, meaning it's a surgical abdomen and it's an emergency, then she deserves surgery. So my journey through endometriosis was a bit complicated when I was arrested. This was me during residency in PGH, and I knew nothing. Honestly, for me, I was a surgeon at the time, and so I thought if you remove the disease, the patient should get well. So I didn't understand the patients who didn't get well, and there were a lot. I mean, you do surgery on them, you did good surgery, you think, but they don't get well. And I was so naive to think that it was their fault, not mine. And this is I don't have any, I realize I don't have any good pictures of myself in training, but this is where my ideas changed. I'm very thankful to my mentor, Dr. Singh in Canada, because he made me realize, chronic pain, endometriosis, it's a different thing. And you need to take our patients seriously. And this is where I learned. And now that I'm teaching, I don't look like I'm teaching there, but I try to impart this on my patients as well, and on my patients and and our trainees too. And this is why we have this forum today. I These are the last few slides, and I just like to stress that women's diseases haven't been given the platform that they need. But look at breast cancer. Breast cancer used to be a one treatment for everyone sort of thing, but now breast cancer awareness, because of advocates, not necessarily doctors, patients, legislators, it has become so different, and now breast cancer is curable. There's so much research going on with breast cancer, and if a woman is said to have breast cancer, you don't feel despair anymore. There's hope. And this is what I want for our patients. And I'm showing this slide today because I think it's a very compelling picture of what endometriosis looks like in the big picture of endometriosis. And this is the life course impact of endometriosis. So this is a graph. I know you're all smart, so you know how to interpret this. So the x-axis is from childhood to the menopausal age, so it's time. The y-axis is the life course of the patient. This includes school, developing and coping skill. The blue line is someone without endometriosis, and the orange jagged line shows the life course of someone with endometriosis. And if you look at it, you see that her life, a woman with endometriosis has stagnation in her life from adolescence up to menopause. And this is majority of her life. And this is the time when she should be most productive. And this paints a really, really bleak picture for us if we do not treat our patients and doctors. And for patients, if you do not seek treatment, it's a bleak life for you. And so that's my plea for today, right? It's not for us to know everything about endometriosis today. It's, if there's one thing that I want to impart today, is that there is hope. Endometriosis should not be as mysterious as it is. We should advocate for research. We should push for legislation. France last year actually had legislation, and they consider endometriosis now as a chronic illness, and patients are being supported. Research is being done, and they've started it. Canada has done it, is starting it as well, and hopefully with our partnerships. I'm very thankful to Endometriosis Philippines, and of course PSRM is always there to advocate for our patients. And patients, you all of you can advocate for endometriosis, and we can make a difference. And so that's my endometriosis life. So thank you very much.
Thank you, Dr. Maris. Sabi ko sa inyo, di ba, nakaka-relax. Parang natanggal yung pains mo. My takeaway from your lecture, patients' complaint of pain is valid, and all the patients should know that, that it's what you're feeling is valid, and that it is not normal. Okay, so yun lang, enough na yun para sa takeaway ng mga patients who are watching right now. By the way, we have 40 to 50 plus sa Facebook page, and on Zoom we have around 100 to 110. Hello everybody who just yung those people who just joined in, you did not miss our main event because we have with us a special guest to talk about her endometriosis life. So that's our main topic for today. Miss Leia Epistola is the administrator of Endometriosis Philippines, an online discussion group for endometriosis patients in Facebook, which was established in 2017. And subsequently, she created a Facebook page to help increase awareness on endometriosis, which was accessible to the public and the wider international community. Ang galing. Leia is an endometriosis patient herself and has been managing her condition since she was a teenager. She is married to her husband, Joseph, and they have a lovely daughter, Erin. So by profession, she is actually an occupational therapist with over 20 years of experience in a variety of clinical settings, but with a special interest in chronic pain management and women's health, among others. Okay, to give her perspective, from the other side naman of the clinic table. So we listened to Dr. Rayap Garcia dun sa being a doctor, no? And this time naman, we want to hear from Leia Epistola kung ano naman yung side dun sa kabilang side ng clinic table natin. Let us invite Leia Epistola to the virtual floor.
Thank you, Dr. Amity, for that introduction. Dr. Maurice, that was a very eye-opening, and really, I think it acknowledged a lot of our patients' sentiments towards endometriosis. So I'm quite blessed and quite honored to be invited to share my experience about endometriosis, my journey. We all know that endo is a very mysterious disease. Each patient will have their own unique way of presenting their symptoms. So that's why it continues to be quite a challenge for both doctors and patients to manage. So I'll talk a bit about my experience, starting with my symptoms, which I think happened or started probably in when I was in high school. Although at that time, mga mild cramps lang during my period. And of course, in those days, nanonormalize kasi yung period cramps. So parang baliwala lang. But over time, I noticed na yung cramps ko were happening even without my period. So that was strange to me. And then as I got older into my 20s, the pain became more severe. And so much so na I had to see a doctor na. So if you think about it, it's probably 8 to 10 years pretty much before I saw a doctor about my symptoms. Because nga, all along I thought it was normal. But because it was happening more frequently and the pain was increasing in severity, so I sought medical help na. And at that time, nakita lang sa ultrasound was a cyst, and the doctor who was attending the consultation was, very quick to say, tanggalin na yung ovary na yan. And and of course, anyone who is in the prime of their life, just a young adult, not even have a family yet, it hit me na possibly hindi na ako magkakaanak kasi mawawala na yung ovary ko. So thankfully, I found my way to a reproductive endocrinologist through my mom's network of friends, and that started my actual management of my endo. So I was already in my mid-20s then. So at that time, I really didn't have the budget for surgery or anything. So the whole time I was single, it was all through medication. So the challenge naman there was really about, having the money to pay for my medication, because it ranged from the oral pill to GnRH, the injectables, which cost thousand of pesos even at that time. So, and hindi naman malaki sweldo ko. So, I had to even get help from my parents to support yung financial side of managing, my endo with medications. So, and then I eventually got married, and my doctor naman thankfully helped me prepare my body for, starting to have a family. And yun nga, na-blessed kami ng husband ko, a few months after we got married, with a daughter. And then, being a young mom in a foreign country, it was so busy, overwhelming, na nakalimutan ko nang bumalik sa doktor ko. So, it probably took me, I got a bit of a break from the symptoms of endo for probably 3 years, and then it started back again. This time, my symptoms were bowel related, and meaning every time I get my period, I would have diarrhea, or and my pain was like I was going into labor every month, every cycle. So talagang napakahirap, and the pain was just increasing each time. And then yun na nga, as usual, di ba, pumunta na ako sa doktor kasi napakahirap na ng situation ko dahil hindi na ako makapasok sa work. I couldn't even sleep because the pain was actually waking me up in the night. It was that bad, and no medication anymore could help. And soon as, my doctor examined me, yung internal examination, sabi niya, may endo ka talaga, surgery ka na. So it was so bad. And true enough, I finally had my first laparoscopy at the age of, I think I was in my mid-30s na. And she diagnosed me with stage 4, very severe endometriosis, because there was a lot of adhesion, yung dikit-dikit na yung bituka ko, and then nakadikit din siya sa uterus ko. Kaya pala, tuwing magna-number 2 ako or mag-open ng bowels, para ka nga namang mangangana kasi wala nang madaanan yung dumi dahil nakatwist na yung bituka ko. So, wala nang choice because I guess I was at risk of yung obstruction ng bowel, and I just, bit the bullet and finally gave in to surgery. But even with that, she said, it's so bad, I cannot even do it myself. I need to refer you. So, hindi niya natapos yung actual surgery ko. She actually referred me to another specialist who was more of an expert with just the surgical management of endo. And so that was the following year. So I went for another operation within, 12 months. And ang nangyari, meron akong gynecologist operating, and meron din siyang colorectal surgeon. And yun nga, super dikit-dikit. Ang nangyari na ginawa nila was a bowel resection. So they had to cut off a part of my bowel kasi nga dikit na damage na nung endo. And then they had to put it together. So buti na lang hindi ako lumabas with a bag, a stoma after surgery, but it was a very long surgery apparently, siguro mga 4 hours yata. So, yun ang surgery ko, pero that was 8 years ago. So it really pays to go to an expert who knows what they're doing. And then kahit medyo mahal siya, pero in the long run, you really save on time and having to have more surgeries because maayos yung tanggal ng endometriosis. My recovery was not that easy. It took probably 3 months for me to go back to exercise. But I'm sort of pain-free now. I don't have a lot of pain, not the level of pain I used to have years ago. I'm on medication for maintenance, like the IUD, and that has been the best medication for me so far. Ang masasabi ko lang talaga na ang natutunan ko for being an endo patient is you can never be too complacent, because like my endo was sort of parang under the radar. Kala mo wala, pero yung pala very severe na sa loob. And by the time it was so severe na I had no choice but to go for surgery na. So I would suggest na, you can't take for granted mild symptoms. Sometimes, if you have regular monitoring of your endo and have that relationship with your doctor, mas maigi kasi mas maagapan. Hindi mo, I guess you wouldn't end up with so many complications like what I had. The other obvious challenge was of yung financial, as I said. And hindi parang sakit ng mayaman ang endo kasi walang katapusan. So kung hindi surgery, medication. So ito ang isa sa mga naririnig ko rin na, I guess, hinaing ng ating mga members sa group is it's a really demanding disease, not just, with the care, but also na it can also take away, yun nga, ang sinabi ni Doktora, was the quality of life. Because it can affect your relationships mo, your ability to work, your ability to enjoy life, diba? So, yun ang isa sa major na challenge for an endo patient. Now, I set up the group because it gives them a chance to air out their concerns amongst people who understand what they're going through. Kasi I have stories from members who say na kahit anong educate nila sa family nila or friends, they don't seem to understand how much women suffer from endo. And that, we're just acting it out, or, who would want to suffer in pain, diba? I mean, everybody wants to live a happy life without pain. So I think that's why we need to really talk about endo, raise that awareness amongst not just healthcare professionals, but the public. Para nga, yun nga, na mahanapan natin ng, I suppose, better treatment, and and women don't have to put up with all sorts of different I guess therapies, medication, and whatnot, just to manage this disease. That's all. And I hope na I was able to share something that other patients could relate to. And once again, I'd like to thank PSRM for this opportunity to work on raising awareness for endometriosis, especially amongst Filipinos. Thank you very much.
Yay! Thank you, Ma'am Leah, ha. We really admire you for putting up this Facebook community. I'm sure ang dami mong natutulungan dun sa Facebook group mo. And, syempre, obvious naman that the patients need to seek consult, no, dun sa mga reproductive medicine specialists. But iba pa rin if you get encouragement from other patients also or experiencing the same pain. So, I am sure sobrang dami nagbe-benefit dun sa Facebook page or Facebook group mo. Maybe later on you can advertise para yung mga patients out there. Okay, so ito na, just as I promised, that's the start of the event, no? We'll have a very interesting no holds barred Q&A with our experts. So, sabi ko nga, it can be like an endometriosis 101 at this point, since our panelists will be answering some common questions and probably debunk some of the misconceptions as well, no? Okay, so joining us is my mentor and second tatay. You all know yung mga clinicians natin out there. You all know he does not like being introduced using his credentials, so just secretly read them na lang. Without further ado, by the way, he doesn't like it when I call him this, no? Let's call on my personal rock star of endometriosis, Dr. Delphine Tan. Hi, sir. Hello, sir.
Okay.
Hi, sir. I
Uh,
can't see you po.
because the host has stopped the video. Could the host start my video?
Can,
Hi,
can
sir.
somebody listen?
Right. Okay, that's good.
Yeah.
Right.
Hi!
Hello.
Yay! Nice to see you, sir. And because you just joined us,
Yes.
sa'yo ko na, sir, ibibigay yung first question. Ben naman a question.
Okay.
At ang galing ng mga audience natin, sir, tingnan mo naman yung question nila. What are the diagnostic tests used to determine if the patient has deep infiltrating endometriosis? O, di ba?
Mhm.
Very maalam ang audience. Sige, sure.
Well, it is still ultrasound. Kaya lang, it's a special form of ultrasound. So when you request for ultrasound, lagay niyo lang doon for deep endometriosis. Tsaka mamimili kayo ng sonologist because not everybody, not all sonologists know how to diagnose deep endometriosis.
Hindi joke yun, Amity.
So,
I agree. I agree.
you make sure that you just don't request for, let's say, transvaginal ultrasound. You say transvaginal or transrectal kung hindi pwede yung transvaginal. Pero lagay nyo din, please look for deep endometriosis. And then, if you know the name of the sonologist, lagay nyo din para sigurado siyang gagawa. So you can ask your clinic and find out who are experts in diagnosing deep endometriosis.
Okay.
It's a little more difficult, a little more painful, but it's really worth it.
Mm-hmm. Agree, sir. Agree. Sometimes kasi, sir, di ba, patients would come to the clinic and tell them na, this doctor diagnosed me with endometriosis, but my ultrasound says it's completely normal.
Yeah.
So, hindi sila naniniwala when they come to you or to your clinic as specialist and you would tell them that you have endometriosis. So, there, to our patients out there,
pwedeng negative yung ultrasound because merong form of endometriosis, yung tinatawag natin na superficial peritoneal endometriosis. Kalat siya maliliit lang siya. Sometimes even microscopic. Kaya hindi mo siya makikita. Kahit na-operahan mo, kung hindi ka nakikita. And that's the reason why kahit mag-opera, kailangan bigyan mo pa din ng gamot because naiiwan yung mga maliliit na endometriosis na implants. Tsaka yung endometriosis hindi yun nasa uterus, nasa labas ng uterus. Kaya kahit tanggalin mo yung uterus, nandun pa din.
Yes, sir.
And you cannot remove what you cannot see. So wag mo sisisihin yung doktor.
Yeah. I'm wondering, sir, kasi si Leia, di ba, you had bowel endometriosis. Did it come up in the diagnostics?
No.
Operation lang ata.
Opo. Kasi meron akong cyst sa ovary, but that wasn't, causing me any problem.
Leia, question.
Opo.
When was your operation? Anong year?
2013 and 2014 po.
Hindi pa uso yung deep endometriosis diagnosis.
Yes.
Opo.
Ito lang lately lang yan, just a few years ago. Yeah.
Yes.
So, wala kang magagawa ng panahon na yan.
Wala po. And
MRI.
recently, nakasubok po ako ng ultrasound for deep endometriosis. And it took probably that That procedure was probably,
Oh, that's
I don't know,
good.
easily 45 minutes. Napaka, thorough, I would say. And they know na ito, they sometimes apparently they use it to help plan for surgery din. Kasi talagang nakikita
Yeah,
na
so
saan yung possible
para
size.
malaman mo kung nasaan yung lesion and that's
Yeah.
your target during the surgery.
Yes.
Yes.
You can refer to the specialists preoperatively. Like, if you see a lot of kidney, diba? Marami na affect na ureters. So you can already refer to urology. In bowel, endometriosis, you can actually, some of them do a colonoscopy or a sigmoidoscopy, even intra, just to see how deep the lesions are. So, yeah. And then they remove them.
Sige, Dr. Romaris, pa-explain naman sa patients natin. May difference ba si adenomyosis kay endometriosis? And is it also possible for one person, for a patient to have both at the same time?
I always say they're like first cousins. They're very, very related, but they're not the same. No? Hindi sila, adenomyosis is endometriotic lesions inside the muscle of the uterus. So in a way, and endometriosis is kalat dun sa, kasi may parang saran wrap ang lining ng mga natin ng bowels and everything inside. So the endometriosis, kinakain niya yung saran wrap na yun. And then eventually it digs in. Ganun siya. Ang adenomyosis galing siya sa loob. And then it makes the uterus, kasi nga inflammation, di ba? Lumalaki yung uterus. Yun yung mga nakikita natin na parang sa ultrasound, yung globular uterus na malaki. So it's different in that way. But I guess the symptoms are the same. Sir, in terms of medical management, is there a lot of difference?
Not exactly. But before that, mga bata pa kasi kayong dalawang doktor eh. Noong panahon namin, we classify adenomyosis as internal endometriosis.
Yes.
And yung endometriosis as external.
Yes.
So during our time, our concept is they're just one and the same. Naging different lang yung location nila.
I believe it's going back to that.
I think so. I think it's about the same. So whatever treatment you have for endometriosis, it's also effective for adenomyosis.
Mm-hmm.
Ang problema lang, you have more bleeding with adenomyosis. And maybe because nasa uterus yun, baka even more pain. But
yes,
yeah.
Galing. Great minds think alike talaga. At tsaka meron tayong telepathy, nabasa nyo ata yung katanungin ko, because that was just the question I was about to ask. Now, one of our patients was asking if there's a difference between the medications or the treatment for both conditions. So, ito, Ma'am Leah, I forgot to ask kanina, kasi di ba you said you had bowel endometriosis, right? So one of our viewers is asking, ano yung symptoms mo ulit when you experience that, and if Dr. Tan can also help us with the difference between IBS, irritable bowel syndrome, and bowel endometriosis. Sige, Ma'am Leah.
For me personally, yung sa akin was it started like a lot of bloating during my period, and then as I got older, ang nangyari sa mga symptoms ko was yung diarrhea, madalas yon. Kahit nung bata ako, may diarrhea ako tuwing my period. And then when I got older, because nagdikit-dikit na yung bituka ko, so mahirap open ng bowel, so magdumi. So tuwing madudumi ako, mapupunta sa toilet, it was really painful kasi nga parang nakatwist na yung bowel ko dahil sa adhesion. And so it was like going into labor every month. And kahit anong inom ko ng pain meds, wala siyang effect, and it just became worse and worse. Yun ang major sa akin was every time I went to the toilet, that was agony.
Mm-hmm.
Literally.
Imagine ko, naawa po ako sa inyo. Naisip ko pala yung
I know.
pinagdadaanan nyo.
Yung dibdib ko.
Ako
I'm
din.
Nakailang anak na ako, hindi lang taong pinanganak.
Swerte mo nga, nagka-baby kang maaga.
Yeah. Sabi ko nga sa kanya,
That's
sir.
very lucky.
Yeah.
Opo.
Had you waited a few more years, maybe you would not be able to have a baby that easily. Kaya yung mga may endometriosis, dapat isipin kagad eh. Kung magbe-baby sila. Kung magbe-baby sila, ngayon na, kaysa later.
Opo. Yun din ang advice sa akin ng OB ko dati. Kaso wala naman akong boyfriend. Paano ko magkaka-baby?
Yun pala yung unang dapat
Yun
recommendation
ang
ng
problema.
doktor.
Yun mo, nahanap matchmaker mo.
Can you imagine,
No, but,
as a teenager, parang you were experiencing all these things and you couldn't understand, you couldn't explain bakit ganun nararamdaman.
Oo.
You know,
Tapos,
we're lucky no kasi may fertility preservation na ngayon,
True.
right? It's not even experimental anymore. So there is that.
Sir, can you please differentiate IBS and irritable bowel syndrome for our audience? Talagang very persistent.
The simple differentiation would be yung inflammatory bowel disease, IBD, primary siya. In other words, sakit siya ng bituka talaga. While yung endometriosis sa labas, na-involve lang yung bituka. So yung sabi nga ni Maris, yung menstruation, di ba, lumalabas to the tube, nag-implant siya dun sa peritoneum, dun sa surface ng tiyan. Right? And then from there, yung implants, pwedeng lumaki siya, pwede niya ma-involve any adjoining structures. So if you have endometriosis, yung tinatawag na DIE, that's in the peritoneum on the surface. And then i-involve lang na yung mga surrounding structures, bladder, yung ureter, at saka yung rectum. So that's from the outside to inside the intestine. Yung inflammatory bowel disease, talagang sa intestine yun. Hindi kami gumagamot nun. Gumagamot ng mga gastroenterologists. Although the symptoms may be the same, but it's actually different ang origin.
Meron ako nakitang interesting na study. They got patients, para siyang retrospective pero prospective siya. Anyway, I won't bore you with that. Anyway, it was interesting kasi they got patients with IBS and then tinignan nila dun sa patients na yan kung sino yung may endo. And then they wanted to see who, and then they gave the FODMAP diet. You know, you know that, the fermentable oligo, blah, 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 blah. Anyway, those sugars, they gave that low FODMAP diet to both groups. And then what they found was that patients with endometriosis and IBS were 3 times more likely to respond to treatment. No? So parang, in a way, maybe the treatments are the same. It's effective. We're lucky because it's effective. You know, the low FODMAP diet is effective for both. So in a way, you just give that, it can help. No, but maybe endometriosis is actually, a lot of patients with IBS are actually endometriosis. Maybe we don't know, right?
If I'm not mistaken, I think inflammatory bowel disease is a very common comorbidity.
Yes, sir.
Of endometriosis. So, madalas magkabarkada sila.
That's true. So, may magpinsan, may magkabarkada.
Yeah. Well, it's not as, in relation niya may not be as close as adenomyosis.
Sir, I think it has something to do with the chronic inflammation na laging nandyan in patients with endo.
Ang basis talaga ng endometriosis is inflammation.
Yes, sir.
Mamagayan. Parang anybody who invade something, or for example, nagpunta dito yung mga Kastila, na nai-irritate yung mga tao. So, kakaroon ng inflammation. So, when you have inflammation, the next thing is scarring. Kasi mag-heal yun eh. So, you have a cycle ng inflammation, repair. And in the process, you develop scars. Yun yung mga tinatawag na adhesions.
Grabe, Sir. Gusto ko lang sabihin, I'm being flooded with a lot of questions. So get ready.
Fire away.
Okay, sir. This one's for you. No. Sige, I'll go to Dr. Amaris first. I'll let you rest kasi marami akong tatanong sa'yo. So this one naman, Dr. Amaris, kasi it says, a lot of participants are asking, no? They're very interested about the side effects. Lahat ng pasyente. Side effects of long-term use of birth control pills. And some of them are asking, can these pills cause hair loss? Tapos one patient naman said she has endometrioma, myoma, and then she's on progesterone pills for 8 months already. Tapos hindi siya nag-menstruate. Is that normal? Sumasakit puso niya and breast pain. So I basically lumped all their questions together because they're all
I know.
about side effects. Okay? So maybe
Yeah.
in one reply, masasagot mo silang lahat.
Well, wala namang gamot na walang side effect. But it's always risk versus benefit. And the benefits, I think, will greatly outweigh the risks of it. Yes, some patients do have hair loss with some progestins. Some a subset of patients who have long-term treatment get certain deep endo after with combined pills. But if you're talking about quality of life, decrease in pain, even the dampening of the inflammation, then it's worth it. I guess one of the things that they're interested about is whether it's safe to have these medications long term. And I'm not saying just 6 months. Yes, it's safe. Marami na tayong studies dyan. Of course, there are certain patients who in whom it's contraindicated. Like, for example, if super obese needs to smoke, you cannot give estrogen, right? You can't give combined pills. In patients na have had clots in their blood, in their in their veins, etc., you cannot give either, no. But it's marami ng studies yan. In fact, in terms of progestins, meron the one that we're giving now, the Dienogest, meron na tayong 7-year study, and it's ongoing na. Kasi parang every year, I guess madadagdagan yung study nila. And our friends in Japan, our colleagues in Japan, have had even a longer experience with this drug. So yeah, and then some medications are given talaga for long term. Like, for example, yung levonorgestrel IUD, no? The implant is given for long term, 5 years yan, 3 years yan. And pills have been here for a long time. Di ba yung combined hormone? Women are taking it for a plethora of reasons. So it's no different, I guess, in terms of side effects. If for women with endo, and then the benefits are there. So yeah.
Amity,
Yes, sir.
Sorry.
may walang gamot, sabi nga ni Maris, walang gamot na walang side effects. Part yan ng buhay. Lahat ng gagawin mo may side effects. Pero mas maraming side effects yung endometriosis.
Totoo. Yeah.
So, mamili ka kung anong gusto mo. Right. So, but it's always a matter of identifying or determining what I call yung risk-benefit equation. Kung mas maraming benefit sa'yo, wala talagang ganyan, merong risk. Wala namang bagay na walang risk sa mundo. But as Maris said, depende yan dun sa bibigay sa yung gamot. So yung doktor mo, mamimili siya, ano talaga yung progestin o ano yung hormone na dapat sa'yo. Hindi pare-pareho kasi ang hormones eh. So you have to have the specialist who will know what type of medication to give to you and what medication will be safer in the long run. Kasi life yan eh, buong buhay mo na yan eh. Theoretically, you have to take your medication up to menopause. And then, pag nag-menopause ka, uobserbahan kung pwede kung walang gamot. Kasi yung menopause, pwedeng gamot din yun dun sa endometriosis. But we are beginning to see endometriosis sa menopause din. If you have 100 patients na mayroong endometriosis, mga 2 to 3 of them are over 50 years old. And if you review the literature, the oldest woman na mayroong endometriosis in the post-menopause is more than 80 years of age. So hindi siya nawawala, nahamblin siya.
Thank you, sir. Ma'am Leah, yes, you would like to say something, right?
Yeah, just a comment. And, I get that question a lot in the group na, side effects. Sabi ko, you need to go back to your doctor to talk about your side effects. They always talk amongst each other na, hoping na mabigyan sila ng payo. But like I said before, na every person is unique, na, yung medical history nyo, iba dun sa next person beside you. So you really have to go back and then talk about your, symptoms para mapalitan, para hindi kayo naghihirap sa side effects din kung nahihirapan na kayo.
Marami namang
Yeah.
choices sa totoo.
Oo,
There's so many
yun nga. You just need to talk about it. But if you don't talk about it, then the doctor can't help you.
Exactly.
That's right. Thank you. Thank you for doing that, no? Kasi some patients, they actually go to Dr. Google instead of doctor specialist talaga.
Yeah, kaya nagkaka-Googleitis sila.
That's right. May bagong sakit na Googleitis pala.
Bago yun
Oo nga. Okay, so while we're on the topic of side effects, we have some of the participants who are actually on the Enogest and GnRH agonists. So they would like to know what are the common side effects, since you already mentioned that lahat naman may side effects, because there's this one patient who's been on the Enogest for 2 years. She gets her period, sometimes wala. Is that normal ba? And then yung GnRH ba, yung side effects niya of hot flushes, would that be normal also? Dr. Maris or Dr. Tan?
Okay. Pinaka-common na nakikita ko with the Endometriosis spotting, the parang irritating na bleeding, lalo na in the first 6 months or so. But I guess you, as a physician, we have to manage the expectations of the patient and tell them about it, no? Kasi it's different eh. If they know to expect it, it's not as bad, right? But it's different kung malakas yung bleeding. There's some patients who have that, but then you have to manage it accordingly. For GnRH agonists, it's the most, I guess the most pressing, the most obvious one is yung tinatawag nating vasomotor symptoms, yung talagang yung hot flashes, para ka nagme-menopause kasi, and dryness, yun yung pinaka immediate complaints. But in the long run, syempre bone loss is an issue, no, for these patients. If you give it for 6 months at a time, no, it's a real issue. So you should, of course, the doctor is the one going to give it to you, right? Because it has to be injected. So ano rin siya, hindi ka pwedeng on it for a very, very long time. Yun lang.
Would you like to add anything, sir?
Yep. Pagka minom ka ng progestins, for example, like tiny chest, yung bleeding actually is a side effect. Hindi siya normal. Ang objective mo talaga, huwag kang magregla. If you imagine what Mary said, yung regla mo, dumadaan sa tube mo, punta sa loob ng tiyan. So pag hindi ka nagre-regla, hindi na nangyayari yun. Pag nagre-regla ka, di nangyayari yung buwan-buwan. Parang dinidilig mo yung endometriosis mo every month. So the objective talaga is to prevent you from menstruating. Yung buhay mo, hirap na hirap pagka nagre-regla ka. Di ba ka magregla? Problema kasi, marami sa ating mga pasyente, akala nila yung regla, maduming dugo. And mas maraming regla lumalabas, lumilinis yung katawan nila. That's wrong. Menstrual blood is normal blood. The less you lose, the better. Tsaka pag nag-lose ka ng blood, lose ka din ng iron. So eventually, pag malakas ang regla mo, iron deficiency anemia. So ang objective natin talaga is to prevent women from menstruating. Kaya pag nagbigay kami ng pills ngayon, iba hindi progestin binibigay, diba, birth control pills, we tell them to take it continuously na, tuloy-tuloy na. Huwag ka na magregla. And if you don't menstruate, better for you. Wala kang problema, wala kang pain, hindi ka nag-anemia, and your life is better.
Totoo yan, sir. Actually, we get a lot of pushback because people are afraid not to get there, to have no menses. No? But we're reassuring you na that's actually the goal of treatment. Sir, diba you've always, laging kinukwento ni Dr. Tanto sa amin when pills were invented, actually walang regla yun eh. Pero kasi since gusto natin na parang normal. Kasi I think diba he was staunchly Catholic, sir, and he was afraid of pushback from the Pope. So he wanted to make it seem like a normal period. So nagdagdag siya ng way para mag-menses yung mga naka-pills. Pero when it was actually conceptualized, walang mens yan.
Isa
So,
kasing problema dyan, Maris, is maraming natatakot na pagka hindi ka na nagregla, for example, you take the medication, hindi ka nagregla, tapos pag in-stop mo, baka hindi ka na magbuntis. They
yeah.
associate that absence of menstruation to infertility. Walang relasyon yun. Yung chance mo mabuntis after the medication or after the pill is the same as before the pill. Walang kasalanan yung pill. Fertility mo is restored. Actually ngayon, if you take the progestins, for example, yung Dynachest, there is evidence now na napipreserve niya yung quality ng egg habang kang umiinom. So, pagka actively treated ka, there is a chance na hindi mag-suffer mabuti yung... Kasi yung endometriosis, kahit meron kang cyst, naapektuhan na yung egg sa paligid eh. Nasisira din yung eggs. The quality goes down. So, if you're under medication, there is evidence now na napiprevent niya yung yung pagbaba ng quality ng egg. So, in a way, yung gamot na binibigay sa'yo, instead na operahan ka, gumating ka muna, nakaka-preserve ng tinatawag namin na ovarian reserve. So, walang regla, mas mabuti. Walang pain. Walang relasyon sa pagbubuntis later.
Yes, sir. While we're on the topic of infertility, actually, we should have been done 3 minutes ago. Papagalitan po ni Dr. Lana kasi overtime. But I'm so happy with the discussion. I'm sure all the participants also are they're learning a lot. But like this na lang. To all our participants, I really tried to compress all your questions para masagot. I'll just have last 3 questions. We'll start with Dr. Maris on the topic of infertility. Then we go to Dr. Tan about surgery. And we end off with Ma'am Leia regarding ang mga natural treatments. Okay? Sige. So, for Dr. Maris, when do you stop medications? This is regarding infertility. No? When do you stop medications? How do you prepare for pregnancy if you're either on GnRH or Dienogest? And what happens, kunyari, if your endometriosis is not treated? Kasi there are patients who are not getting treated right now and they're working on for fertility. So kindly discuss a little about the medications and fertility po.
I'll just go broad, no? Parang
Yes,
basically,
please.
if a woman's goal is to get pregnant, don't give anything to suppress. Don't give hormonal treatment to suppress. Get her pregnant. So it doesn't matter if she was on GnRH agonists before or Dienogest or combined contraceptives or she has an IUD, take it out, no? Stop the medications and then wait for her next cycle and then stimulate her. No? The basic thing is that patients with endometriosis need medically assisted reproduction. Hindi na yan observe. We need medically assisted reproduction because unang-una, time is of the essence. Patients are at risk for premature ovarian failure. Insufficiency. So they need help already. Baseline. Lalo na if na-operahan sila before. We see a lot of these patients na hindi naman sila sa infertility doctor initially pumunta. So pagdating sa amin, isa na lang yung ovary nila tapos may cyst pa. So, di ba, nakakatakot pag ako kinakabahan ako pag ganon. So, immediately, you stop their hormonal medications and then get them pregnant already.
Okay. Sir,
Yep.
I'll read the question dito kasi I'm sure ikaw yung perfect person dito. Sabi ko nga, you're my personal rock star sa
Mine
endometriosis.
too!
I wish I can show you photos of our before and after surgeries na endometriosis. Return to normal anatomy. Okay. So, the question is, when do you need the operation? And yung question kasi din nung participant natin is that, why do you need to take pa medical management like GnRH, then the Dienogest, if eventually you'll end up in surgery? And if you do end up in a surgery, anong pipiliin ng pasyente? Laparoscopy na bubutasan ka daw at mabilis ang recovery, or open surgery na mas malaki yung sugat pero mas makikita ng personal lahat ng nasa loob?
Okay, number 1, kaya ka naggagamot para hindi lumala. Pag hindi mo ginamot, lalala yun. Lalo kang mahihirapan. So, the treatment should be as early as possible and to prevent yung severe disease. Because all of them will start mild, then become moderate, and become severe. Pag pinabayaan mo, you will wake up one day with severe disease like Leia. So you have to start early. Kung pwedeng ma-diagnose yan as early as possible during adolescence, the better. Para you can start treatment and prevent the disease. Now, when do you operate? Number one, kung hindi siya nakukuha sa gamot. Kung ang problema mo, pain, na-try mo na lahat ng klase ng gamot, hindi pa siya gumagaling, hindi pa nare-relieve yung gamot, talaga nahihirapan ka na, then you operate. So, unresponsive to medications. Pero bihira na yan, magagaling yung mga gamot ngayon eh. Pangalawa, kung gusto mong magbuntis, at saka yung dahilan ng yung pagbubuntis dahil dun sa endometriosis. Hindi naman lahat ng endometriosis hindi nagbubuntis. You have to find out whether endometriosis has something to do with infertility. Kaya you will work up ka ng doktor, right? And then, secondly, dun sa infertility, depende din sa age mo. If you are over 35, maybe you don't have to test for that anymore. Mag-IVF ka na lang kasi time is of the essence. Pangatlo, yung mga pasyente na may endometriosis pero merong potentially obstructive lesions. Yung pwedeng bumara sa bituka, kaya kay Leia, o bumara sa, mas more commonly, maring bumara doon sa dinadaanan ng iya, doon sa ureter. All of them will be considered candidates for surgery. That is already severe disease, yung tinatawag na DIE. Yung deep endometriosis, nung araw, pagka deep endometriosis, opera ng opera. Ngayon hindi na. 80% of deep endometriosis will respond to medication. Now, pagka yung pasyente, menopausal na at merong endometriosis, o tingin mo may endometriosis, yun inoperahan yun. Kasi gusto mong masigurado na hindi yung cancer. So those are the 5 conditions where you may have to operate on a woman with endometriosis. Tsaka kung mag-opera ka, mas maganda laparoscopy. Number 1, na ma-magnify mo yung lesions eh. You use the camera, you can magnify the lesions as much as 10 to 15 times. So, tumitingin ka sa television mo, malaking tao, so mas maliit na lesion na nakikita mo. But in spite of that, kahit na maliit yun, malaki na-enlarge mo, may mga microscopic lesions that you cannot see. And those lesions will be left in the pelvis or in the abdomen, and they can become yung nidus, yung umpisa ng mga magiging recurrence mo. So even after medication, after surgery, magme-medicate ka pa din. Kaya nga madalas, medication na muna kasi kung makuha ng medication, hindi ka na mag-ooperan. At kung all your life, kayang-kaya ng medication ng menopause, bakit ka pa mag-oopera? Tsaka yung operation mo, kung pwede, yun na ang first and last operation. Hindi ka gaya nung araw, opera kami na opera. Kasalanan ko din yan, dami namin yung opera ng endometriosis. Kasi wala nagtuturo sa amin ng tama eh. Pero ngayon, hindi nang tama din sinabi ko. Kasi ngayon, iba na kasi yung ideas about endometriosis. We have evolved already tungkol sa endometriosis. Nung araw, endometriosis is a surgical disease. Textbook ng gynecology, endometriosis surgical disease. Ngayon, hindi na eh. It's actually more of a medical disease.
So it wasn't that long ago,
Well, yeah, but marami pa kasi nag-oopera ng endometriosis basta. So hindi na kami nag-oopera ng endometriosis hanggang hindi talaga kailangan.
Okay. Ito na talaga, last na to, Ma'am Leia. So, for those patients, so, ang saya kasi ng discussion, no? But we really have to end our session. But before we go, kindly inform our patients, no, what they can do at home. Kasi pandemic pa rin eh. Although marami ng tao nasa labas, we're still within the pandemic time, no? So, a lot of patients are asking what they can do at home. Food, natural treatments or natural therapies at home that you can recommend to these patients?
Personally, I'll talk from experience, no? Kasi nga, yung symptoms ko were bowel related. So, a lot of that was triggered by food as well. So, it was sort of a trial and error for me. I didn't really go to a dietitian para mag-consult. Pero, since na-operan ako dun sa bowel, parang iba na yung gut, response ko to certain foods. So, for example, yung sa sugar, very inflammatory siya. Talagang nagbo-bloat ako ng sobra. So, what I was also recommending actually to our members was to keep a food diary. Kasi nga, iba-iba tayo ng reaction ng katawan natin towards food. and we have different diets, we eat different foods naman. So we cannot just pinpoint one group of, food. So, ang sinuggest ko sa kanila was to keep a food diary and then to find out ano yung symptoms na experience nila after having that sort of meal. So then you can sort of, rule out na, ito siguro nagtitrigger ng bloating ko, ganyan. So mas madali. And then if they really struggle with, finding yung right kinds of foods to suit their lifestyle, doon na siguro yung kailangan pumunta sa dietitian to really get that specialist, advice. The other thing is exercise. After my surgery, talagang sabi ko, I felt so tired kasi siguro sa anesthesia, part yun ng parang side effect na nag-surgery, talagang pagod na pagod. So, I really sort of, made sure na I got back into some sort of physical activity. Kasi kung wala, parang feeling ko, lalong nag-adhesion ulit. So, I did a lot of yoga, so a lot of stretching. So, yun ang talagang naging go-to ko to recover from my surgery. And I feel better as well kasi I move better. Yung flexibility ko, yung gano'n. And stronger as well. Tapos yung core mo, na-work din. So, parang na talagang you're working on those, that specific area na talagang na-affected nung surgery ko. So, exercise, sleep. So, minsan kasi sa sobrang pain, di ba? Or whatever worries we have, dala ng endo, sleep is affected. So, yon pwede rin na, actually part yun ng work ko eh, na about sleep hygiene. So,
Leia, I have a question.
Oh.
What about the sex life?
Ha?
Sex life.
Ano po, tungkol?
What about the sex life? Did it improve after the surgery?
Kasi may naggagamot po ako eh. So, that
dapat
was
ibalik
also,
mo.
Ibalik ba?
Yeah.
Agree.
Yeah. Your quality of life is not complete without that.
That
is true. Opo. I guess for, depende po sa situation din ng mga pasyente. Ano po?
Basta balik mo.
Okay.
Try natin.
You'll not be complete unless that's being done.
Opo. If you're in a, wonderful relationship, of course. Yes. Yes. Yeah, and yun nga, yung mental health natin, po. Kasi nga, COVID, a lot of people are also suffering from the side, from isolation and stuff. So, talagang self-care, I guess at the end of it, self-care, what does self-care look like to you? Then that is a bit more, you have to find that. What makes you happy? What are the things you enjoy? And
sparks joy.
Diba? Sparks joy nga. Oh. And even with exercise, they keep asking, anong exercise? Anong specific exercise? And well, depende sa lifestyle nyo. Yung ako enjoy ko yoga, pero yung iba ayaw, diba? So you really need to find something that you enjoy doing, so you'll keep doing it. So, yun ang suggestion ko.
Okay, thank you very much. What a way to end our discussion. Very, very informative. And even as a clinician, I learned a lot from you, Ma'am Leia. And thank you for being with us. Unfortunately, that's all the time we have left. Mapapagalitan ako ng mga
installment to sa October.
Nga, correct.
Sige,
we'll post that later.
Yeah, what direction to go.
So thank you to our panelists, and to show our appreciation, PSRM would like to present these certificates. Sa name certificates natin. Okay, so present these certificates to Drs. Maris Yap Garcia and Dr. Delphine Tan. Drs. Maris Yap Garcia and Delphine Tan, Ma'am Leia Epistola, myself, and Bayer for their invaluable time and support during this Lay Forum. Now, let's call on our industry partner from Bayer Philippines for a few words, represented by their marketing head, Ms. Arlene Celestia.
Thank you so much, Dr. Amity. And good evening, everyone. It's an honor and privilege to actually be partnering tonight with our Endometriosis Awareness Month. Dr. Debbie Megiso, President of PSRM, thank you for thinking of Bayer when you were planning for this Endometriosis Awareness Month. Truly, tonight has really been personal for me as well. Being an endometriosis patient more than 20 years ago. So, when Dr. Maris Yap Garcia was explaining the phases of endometriosis, ang nasa isip ko, akong ako yon. From the severe pain to the debilitating quality of life I had from college to my mid-20s na supposedly the peak of my life and having surgery. And the tipping point for me, Mom Leia, was they thought that I had appendicitis. I was brought by an ambulance to Cardinal Santos and only to find out that it was my second day of menstruation and heavy bleeding. So I had my surgery and thank God for really the doctor who took care of me. I was blessed with two daughters after my surgery. So there's life after endometriosis. And Dr. Maris Yap Garcia, thank you so much for bringing light to a topic that is not normally discussed, but very much affecting a lot of women as we now see right now. And to Miss Leia, thank you so much for this platform that you've really put in. You're bringing hope to the new generation of patients with endometriosis na hindi kagaya nung time ko na it's only our moms or our titas na ang sinasabi is part ang dysmenorrhea ng pagkakaroon ng menstruation. So there's a lot of awareness building that you've done and through your platform, and for that, thank you so much. And of course, with our expert panel, Dr. Delphine Tan, and our very engaging moderator, Dr. Amity, thank you so much for really indulging and answering all the questions of our patients. And to the women out there who's listening right now, whether you're suffering from a mild dysmenorrhea or to the most severe one, now is not the time to be timid. We're not just celebrating Endometriosis Awareness Month for March. It's actually International Women's Month. So I hope that you have been encouraged not only by the lecture of our speaker, but as well as the testimony of our patient advocate. And you will have the courage to consult your doctors with the symptoms that you are experiencing. And if you need more awareness about endometriosis, aside from Endometriosis Philippines, you can actually ask Mara, our go-to gal chatbot, about the situation or the symptom as well. So with that, thank you very much, everyone, and good night.
Thank you,
The
Bayer.
pill.
Ay,
You know,
meron pa pala.
the pill. Just two unremarkable words. But 60 years ago, it changed the world in a remarkable way, supporting women to have children by choice, not chance. It helped us pursue our own ambitions and take on the world. It empowered us to reach for new heights, support the children we have, and strive for lives free from hardship. To shape our own futures and to shape others. And to live our lives our way. 60 years ago, a world of opportunity started with the pill. Since then, Bayer has been bringing women benefits in contraception and beyond, and continued to innovate decade after decade. All that started with just one little pill. Celebrating 60 years of empowering women. Bayer, your partner in women's health.
Thank you, Mayor. And to close our event, I would like to welcome our very talented and witty Vice President, Dr. Romerico Torres.
The phrase walang forever may be true in a lot of circumstances. Unfortunately, for a disease such as endometriosis, it may plague women during their lifetime. Understanding the disease, having professionals, not only clinicians, to advocate for patients in their quest for relief, while temporal, are integral in holistically addressing the complexities of living with endometriosis. It is our hope that with the new knowledge gained from the experiences and perspectives of our esteemed speakers, you have been enlightened not only on the disease processes, but also somehow one's burden is shared with similarly afflicted individuals and with professionals who not only care for, but also work to empower you in handling the disease. Thank you to Professor Delphine Tan, Dr. Mari Garcia, and Ms. Leia Espitola for generously sharing your time and experiences with us all. Thank you also to Bayer for continuously partnering with PSRM and being part of its growth. Good evening, and the Lord keep us all safe and well.
Thank you, Sir Miko. Di ba ang witty talaga ni Sir? But before we end tonight's event, we hope to see you in the following day lectures. We have one on March, another in June, August, September, and October. These are the dates. We have installments pa ng endometriosis. So kung nabitin kayo tonight, you have 2 more chances pa, 3 more chances actually. And we'll talk about also about infertility and contraception and PCOS. Okay, so there you have it. Thank you for joining us and have a pelvic pain-free weekend. Peace.